redness, itching, watering, and foreign body sensation. These are the common signs and symptoms you will see in a patient having viral conjunctivitis. Let's first define conjunctivitis. It is the inflammation of the conjunctiva. Conjunctiva is the layer that lines the white part of your eye, that is the sclera, that is lined by conjunctiva, and the upper and the inner eyelids, it is also lined by the conjunctiva. So if there is inflammation of conjunctiva due to any cause, that is known as conjunctivitis. Now it can be either caused by allergies, viruses, bacteria, three most common causes. So in this video we are going to discuss about viral conjunctivitis. So this is defined as inflammation of the conjunctiva due to viruses. Now viruses, the most common class or the most common subgroups of viruses that cause conjunctivitis are adenoviruses. 90% of these cause viral conjunctivitis. The other remaining 10% are caused by herpes simplex viruses, varicella zoster viruses, and so on. Now remember, adenoviruses also cause common colds, upper respiratory tract infection. So a person can have that at the same time as well. He can have cold, cough, flu, and he can present with ocular symptoms as well. Or he can simply present with isolated ocular symptoms. But you need to know that adenoviruses are also responsible for the common flu, the common cold. So a person presents into OPD with the chief complaints of watering of eyes, itching, redness. It will be diffuse redness. All of the conjunctiva will be involved equally. There will be foreign body sensation, and in severe cases the eyelids can be a bit swollen, and sometimes there can be light sensitivity, which is known as photophobia. So what is the first step you do? You need to take care of yourself because it is highly contagious, this infection. It can even go from one eye to the other eye. Another hallmark of this disease is that patient can present with either unilateral or bilateral eyes. But if he is having unilateral, your diagnosis or suspicion of viral conjunctivitis further increases. So you need to take care, and before you present another patient on that seat, you need to sterilize that area and you need to wash your hands so it doesn't transmit from them to you or to another patient. So when you examine the patient, apart from redness, inflammation, you will see follicles on slit lamp. Follicles will be like some white dots you will see on the conjunctiva, on the lower eyelids and the upper eyelids. If you invert them, you can see it in the picture here. This further confirms, or this is the hallmark of this and this disease. So what is the next step you do? First you have to educate the patient. It's a viral disease. That means it will complete its course in around about 1 to 2 weeks, or in severe cases 2 to 3 weeks. It will resolve. In majority of the cases you do not need any treatment, and the only treatment you need to do is wash your eyes with cold water. It really helps. It soothes your eyes and relaxes, and the complaints of itching, watering, redness are temporarily relieved. You need to educate the patient about the spread of this disease. It can go from one eye to the other eye. It can infect other members at home. So you need to change your towel or isolate your stuff such as towels. You need to wash your bed sheets or pillow covers regularly, and you need to take care when you touch your eyes. You should wash your hands or sanitize your hands regularly. One other thing is that the spread of this viral conjunctivitis is before the onset of symptoms. We usually take cover when the symptoms have developed, but before that you don't know how many people you have infected. So this is another thing which we cannot follow up, or we don't exactly know how many people we have infected. So that's another thing which is worrisome, that we do not know how many people we have infected before the development of symptoms, because that's usually when a person starts to take care. So remember, it can be spread by infected towels, clothes, bed sheets, or through respiratory droplets, because a person can have flu or cold at the same time. So let's come to the treatment now. First, you need to educate the patient that it will resolve completely in 1 to 2 weeks, or in severe cases 2 to 3 weeks. You should wash or do cold compresses. Apart from that, you can prescribe mild, moderate, or severe steroid depending on the condition of the patient, depending on the inflammation and the complaints of the patient. That the steroid will relieve his itching, redness, and watering. So other than that, you should need to prescribe antibiotic to prevent superimposed bacterial infection. You can start with a weak antibiotic such as ofloxacin, You don't need to jump to moxifloxacin or something like that, but you can start with weak antibiotics to prevent superimposed bacterial infections. Then you can prescribe artificial tear drops. This really soothes or relaxes the eyes, and the chief complaint that the person has, it will be temporarily relieved. And there are no side effects of artificial tear drops, so you can prescribe it for as long as you want. So this viral infection, it can be sporadic, or it can present as epidemics in certain places such as hospitals, swimming pools, offices. So you need to educate yourself, educate your friends, and in the end, the main thing is don't panic. And the reason why it is so contagious is the ability or the capability of these viral particles to survive on dry surfaces for weeks. And the other thing which I mentioned earlier is that a person can spread this even before the signs and symptoms have appeared. So that is why it is so contagious. But like I said, don't panic, educate yourself, follow the guidelines, and you'll be okay.